Cooper,
And I'm Dr. Scott Sattler.
and we are Sound Plastic Surgery located in Seattle, Washington, right next to University Village. Today we're going to talk about tummy tucks, also known as abdominoplasties, and we'd like to discuss the operation in detail. We'll also discuss what the consultation is like here at Sound Plastic Surgery, and then we'll go ahead and talk about what to expect after the operation.
Yeah, a tummy tuck surgery is a complex plastic surgery operation. It's one of the biggest operations that we do in plastic surgery. So during the consultation, there's a lot to talk about. We'll review the risks and benefits of the operation and what version of the operation is right for you. We'll review some of the technical aspects of the operation, how it's done surgically, and then importantly, we'll go over some of the recovery details that you can expect after your tummy tuck surgery.
Consultation, we want to make sure that we understand exactly what your goals are and what your expectations are. Not every tummy tuck is the same, and both Scott and I will tailor the tummy tuck, the actual way that we perform the procedure, to each individual's body habitus and also with specific regards to what your goals are. Oftentimes we'll include some liposuction during the procedure to the waist area and to the back, or sometimes patients will call that area their flanks. Liposuction is a great adjunctive measure to help really trim, to really make the waistline look more trim. Some patients, on the other hand, don't need liposuction, but a lot of patients can benefit from it.
Yeah, there's a variety of tummy tuck techniques that are tailored to each individual patient. And part of the decision making depends on how much skin excess a particular patient has, whether or not they have abdominal wall laxity or so-called rectus diastasis. And then, importantly, the appearance of the belly button and the appearance of excess fattiness along the waist and hip area. So there is a so-called mini tummy tuck that addresses just excess skin from the belly button down to the pubic bone. And that procedure we don't perform very frequently simply because it doesn't do anything for the belly button or excess skin above the belly button. There is a standard tummy tuck, which is kind of a generic term that deals with abdominal wall laxity, deals with the appearance and shape of the belly button, and deals with excess skin, whether it's skin below the belly button or above the belly button. And then lastly, there's a so-called extended tummy tuck that deals with substantially excess skin that swings around the hip area. And obviously that surgery is more extensive and has a longer scar, but the trade-off is it delivers a much better cosmetic result. So we tailor this operation to your individual anatomy. We do a tummy tuck operation under general anesthesia. It's not possible to do a good quality tummy tuck or abdominoplasty under local anesthesia, and nor do we even feel that deep intravenous sedation is effective for a good quality tummy tuck. So patients are completely asleep. The operation begins by making an incision low down on the pelvis. We typically try to keep the incision and ultimate scar as low as we possibly can because patients can hide that scar beneath a bikini or beneath underwear, but also because the lower that scar is on the pelvis, the more it pulls up on the upper and outside of the thighs and gives a bit of a thigh lift effect. And so that's kind of the style of tummy tuck that we use.
Right. So on the morning of your operation, either Scott or I will meet you outside the operating room, and we'll make a bunch of markings on your abdomen just to help us kind of line things up during the actual operation. Then you'll go back to the operating room, and once you're asleep, we'll begin the procedure. After we've made that low incision through your skin and subcutaneous fat, we then lift up the skin, that's called a flap, and we then lift that up all the way up to the lower part of your sternum. And once we've developed that plane, we then go ahead and actually tighten up the muscles. You have a pair of muscles called the rectus abdominis muscles, and we use special sutures to bring those in together more tightly, and that's what gives the abdomen a really flat appearance. After that's done, we then pull that skin down and remove any excess skin that we can, and then we bring the belly button or umbilicus back through that flap and sew it into place. So most patients will end up with a scar that's very low down, and then also a small scar around the belly button. The belly button, we take special care when we're sewing that in place and shaping it to make sure that it's vertical and narrow and has a pleasing appearance. A lot of patients, before their tummy tuck, have a transversely or horizontally oriented umbilicus or belly button, which isn't very aesthetically pleasing. But post-operatively, that incision's small, narrow, and vertically oriented. We also really try to hide that scar inside the belly button or umbilicus, which makes it have an even better or more pleasing appearance.
We found an important part of almost all tummy tucks that we do is liposuction in the waist area. And this can be done just before starting the actual tummy tuck procedure in the operating room with the patient lying on her stomach, or it can also be done for less extensive liposuction cases with the patient lying on her back just after the tummy tuck. But we feel that removing fat from the waist and hip area narrows the waist, creates a more feminine silhouette, and has vastly improved our liposuction results. Technically, it's not safe to aggressively liposuction the abdomen itself during a tummy tuck. And so the way that we remove fat from the upper part of the abdomen is directly excising fat from the back of the abdominal flap when we have it elevated. And that creates a much thinner flap and a more aesthetically pleasing upper abdomen. We typically use drains when we do a tummy tuck. The drains are important because they eliminate dead space between the abdominal flap and the underlying muscular and fascial tissues. This prevents or at least diminishes the risk of seromas, which are fluid collections that occur after surgery. The drains typically stay in place between 5 to 7 days and then are removed. We recommend to our patients that they stay in a compressive garment most of the time for about 6 weeks after tummy tuck surgery. We feel that this greatly enhances their surgical result and diminishes the risk of seroma.
Right. In order to help with post-operative pain, both Scott and I are big believers in using a medication called Exparel. It's a long-acting local anesthetic that we inject just above the muscle, just underneath a layer called the fascia. And we place this Exparel anesthetic into the area that we're going to be plicating. So those two rectus abdominis muscles that we bring together more tightly to give the abdomen a flat appearance, that's exactly where we put the Exparel. It really seems to work for about 72 hours, up to 72 hours after the operation, and really does diminish the amount of pain medication that our patients usually have to use.
Yeah. A couple other details of the procedure. All the sutures that we use, with the exception of the sutures that are around the belly button, are absorbable sutures. Our patients typically wear some steri-strips or surgical tape along their scars, especially along the pelvic scar, for at least a couple of weeks after the surgery, because we feel that this greatly enhances scar quality when the early scars are being sort of pressed upon by a flat surface like tape. Generally, the scars are relatively pink and noticeable up until about the 3-month mark, and then gradually fade away with time until ideally a fine white thin line scar at about 1 year. And the belly button scar, as Josh said, we try to internalize, so when someone's looking directly at your post-operative belly button, they don't really see a scar at all. They just see a nice looking youthful belly button.
As far as post-operative care is concerned, almost all of our patients go home the same day or same evening after their procedure, and we see our patients back a week later. While at home, as Scott mentioned, it's important to keep on that compression garment to help with swelling, and you'll also be taught how to take care of the 2 drains that you'll be going home with. Patients are prescribed some antibiotics as well as some pain medication, usually narcotics, that most patients take for several days. Scott and I are also really big believers in prescribing our patients a medication called Lovenox. Lovenox is basically like heparin. It's actually a kind of heparin, and it's actually a blood thinner. And we prescribe our patients this medication to help prevent blood clots in the legs, also known as deep vein thromboses or DVTs.
Found that, at least in our review of the medical literature, that the use of low-dose Lovenox substantially reduces the risk of DVTs in patients that undergo a major surgical procedure under a general anesthetic. And we've kind of brought this idea into our own practice, and it's, I think, in some ways become the standard of care, at least in our surgical community. A DVT in of itself isn't necessarily dangerous, but when that DVT migrates and goes up to the lung and becomes a pulmonary embolism, that can put patients' health at substantial risk, could even cause death in the worst case scenario. So we feel that using low-dose Lovenox for 7 days after surgery is an important safety adjunct. We do teach the patients to use the medication. It is an injectable medication, but it's just like administering an insulin shot to oneself. It's just a subcutaneous injection. And patients get quite used to it, and before they know it, they're done with their Lovenox after 7 days. Let's talk about recovery a little bit. The recovery outlook after a tummy tuck can be extensive. Some patients bounce back from the operation quickly and are back to work feeling good just after a couple of weeks. Some patients need more time to recover. It really depends on an individual's constitution and their occupation and what the responsibilities are at home. So we always assess during the consultation how much help you will have at home when you're recovering from this operation. If you're a single parent with not a lot of family locally, this is probably not a good operation to do unless you can enlist the help of some friends or possibly coworkers or distant family members. And we tell all of our patients to plan on taking at least 2 weeks off of work, realistically 3 weeks off of work, and some patients need 4 weeks off of work. So it's a big time commitment to recover from this operation.
But most, if not all of our patients definitely think that it's worth it. That's for sure.
Yeah.
It's one of those operations where we can have a really dramatic effect on how your abdomen looks and how you'll end up feeling about your body in general. It's one of our favorite operations to perform.
Yeah.
We love it.
Yeah. I think when we go through our photo galleries, the ones on our website or the ones that we share with patients, the most dramatic transformations are the tummy tuck galleries, where we can take a patient with substantial amount of excess skin, a rounded, kind of aged-looking abdominal contour, and create a nice flattened, youthful-looking abdomen. And there's just no other procedure that can deliver that type of result besides a tummy tuck.
Yep.